Hello, I'm Sharon with Nurse Tim, and I'd like to thank you for joining us for our webinar, Test Policies and Blueprints Made Easy, featuring Virginia Ginny Wangerin. We will have technical assistance available at 866-861-2896, option 1, or help at nursetim.com. Handouts are available to download for our live viewers in your login email and for archive viewers on the right side of your screen. Please note, handouts are for personal use only and are not to be distributed to others. On the Zoom toolbar, you'll find the Q&A pod usable by our live attendees. At the end of our webinar, we look forward to a discussion with your questions in the Q&A pod. Our archive listeners are encouraged to drop us an email or give us a call. We also value your input as to desired topics for future webinars. ANCC disclosures. NCPD. This webinar has been awarded one Nursing Continuing Professional Development Contact Hour by Nurse Tim Incorporated. Nurse Tim Inc. is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Centers Commission on Accreditation. Successful completion. Criteria for judging successful completion of the webinar are attendance at the entire activity and submission of a completed evaluation. Expiration date. Archived activities must be completed and evaluations submitted within 30 days of accessing from the Nurse Tim Inc. website. For more information, contact help at nursetim.com. Learning outcomes. 1. Discuss the benefits of implementing a comprehensive test policy to guide faculty decision-making. 2. Identify the components of a well-designed testing policy. 3. Describe the process of blueprinting exams to your curriculum design, including the NCSBN test plan, nursing process, and clinical judgment for fairness and balance across the program. Throughout this activity, the speaker may use a variety of real and varied resources from health education vendors. They are for illustrative purposes and are not to endorse any product. All images and references to the NCSBN Next Generation NCLEX are the property of the National Council State Boards of Nursing and provided for teaching purposes only. And now I'm so pleased to introduce our speaker. Dr. Virginia Ginny Wangerin is an educator, consultant, and speaker with nearly 40 years' experience in nursing. She has taught at the ADN, BSN, and graduate level and is currently Assistant Clinical Professor of Nursing at Iowa State University. Dr. Wangerin is recognized as a lifelong leader and nursing advocate, serving on numerous committees and boards, advocating for the profession and at-risk populations. She was most recently honored as one of Iowa's 100 Great Nurses for 2020. She has developed and implemented concurrent enrollment programs and concept-based curriculum. Dr. Wangerin is a consultant and speaker for accreditation, curriculum development, learning strategies, and outcomes assessments. We are so thrilled to have you with us today, Ginny.
Thank you. Thank you so much. And I'm excited about this day when we are doing a series of webinars to talk to you about testing practices in nursing education because it is so important. And so I would like to start by asking a question. So if you're in our live audience, please go ahead and fill in your answer here to the first question. Which statement best describes you when it comes to creating, administering, analyzing, and improving your teacher-made exams? That, in a nutshell, is what we're going to talk about today. So I'm curious to see where we are starting, so take a moment to answer that question. If you're in our archive audience, you can answer that for yourself and then hear a little bit about how our live audience responded. You could also pause for a moment and talk about this with your colleagues if you're watching it together, which is a great way to take advantage of these webinars when they're in the archive version. We will watch for the responses to come up. It looks like some of you said A, not prepared for this aspect, and that is absolutely fine. If you're with us for the entire day, you will feel much more confident, I hope, at the end. And because these will be also archived in the, you can retrieve them later for review. A lot of you were in the B and C range, right? So you're getting better or you've become more skilled, you're getting some confidence. That's a great time to revisit, to learn a few more things that you can apply to get a little bit more comfortable. And there are a few of you that feel pretty comfortable with the process and recognize that we can always learn more. And I tell you, after 40 years in nursing education, I find that to be very true. So Sharon, we can go ahead and close that poll. And I appreciate that people share that with us. So let's go ahead now and talk a little bit about the purpose of tests. Why do we test? I don't think most of us as learners or educators get real excited about the testing process, right? It's a bit stressful. It's sometimes high stakes. For students, I think every exam is some sort of anxiety producer, right? But we test because we need to assess achievement of learning against our established goals or objectives. In other words, this is the best way we have using assessment to discover if students really understand what we want them to know and to be able to apply and use. And now in the language of competency, this is so important. So we're assessing that current knowledge in addition to their competency, their ability. And that could be for placement within the program or even for progression from term to term. We also, of course, use tests to assign a grade or to determine if a student's going to pass or fail a particular component of our curriculum, whether that's a single competency, a clinical rotation, a standardized simulation, whatever it is. Grades are a part of this world in higher academics. And then finally, we also want to assess their readiness for licensure or for certification in the graduate programs. It also provides us valuable curricular feedback so that we can use the results of testing not only to inform students and to support their growth and in some cases remediation, but also to support the improvements, the continuous quality improvement of our program. So our testing is deeply linked to the entire curriculum. And that's a piece I want us to keep in mind as we think about this first session, when we're talking about policies and blueprinting and really establishing a baseline for this whole process of assessment. So let's think about the kinds of assessments we use in nursing. We have essentially formative and summative. And those formative assessments are intended to be more low stakes, right? Those are our quizzes, our stop and do an activity that gives me some feedback on how well you've understood this, how well you can apply this content to a nursing situation. Our unit exams are typically considered a formative form of assessment, even though they are graded, but it is formative. And for most of us, we have that end of program exam or end of course exam, if you will, that final exam will be a summative assessment. Formative assessments also help us to prepare for the next level or for the clinical experience, simulation lab, et cetera. So we often incorporate those into sort of that preparation, if you will. And formative assessments tend to be criterion referenced. In other words, students being compared to the correct answers, not to each other or not to a pool of test takers, unlike standardized exams. Now, for our summative assessments, those are either criterion or norm referenced. Norm referenced being those standardized exams, or when you have used your pool long enough to actually have some historical data so that you can compare this class with previous classes. We also use summative for that final exam in the course. Many programs will use a mid-curricular exam. Okay, we're partway through the program or we have completed certain aspects. We're going to use a standardized exam to make sure that we have met our objectives or our competencies that we expect at this point in the program. The other advantage with that summative assessment then is that we can still look at that detail and we can do remediation, we can do improvements, we can go back and reinforce something that was determined to be a weakness in the results for either that particular class or for our curriculum. And we know that in summative assessment, the exams are building on the previous content within that semester and often even in previous semesters that build in our curriculum. Now, the bottom line is that we test because it's about our outcomes. It's about our progress toward our student learning outcomes. And those outcomes in nursing are about safety. The NCLEX is about safety. Safety is a significant concern in healthcare today. And what does safety involve? It involves good decision making. It involves priority setting. It involves using clinical judgment. And that's going to be a theme also throughout the day today. And we use it to create or replicate reality. So testing is a way that we can bring this together and make sure that our students are going to be prepared to meet the learning objectives at the end of the program and to be a safe nurse entering practice. So, testing policies, what it is. A testing policy is essentially a series of documents or a lengthy document, if you will, that defines and guides every aspect of how we do this testing process, how we put it together, how we administer it, how we assess it, what we do with that information. So it guides us in that process. And it's not just faculty. The testing policy is really intended to be a transparent document that provides this same consistency of information, this guidance on the processes and procedures that impact students and stakeholders. So our testing policy needs to be congruent with everything else that we do. Testing policies not only provide guidance, but they protect the stakeholders. Remember, our stakeholders are our students, our colleagues, our partners in practice. It helps to assure that we are providing an evidence-based, fair, and consistent assessment of our students and making decisions using those same principles of evidence-based, fair, and consistent decisions. So, why does it matter and what does it include? Testing policies will provide transparency, which is important. Transparency also helps to enhance consistency. It keeps everybody on the same page, following the same process, if you will, making decisions using the same guidelines. So it defines the criteria and the guidelines for effective faculty-made exams. So when it comes to putting together an exam, when it comes to how many questions, how long do we give, those are all decisions that should be consistent within our program. It gives us guidelines for creating and assessing our questions. We want our questions to be valid and reliable and to adequately assess student knowledge and performance on that particular set of objectives. The testing policy provides us some strategies that help us make sure we are providing reliable and valid exams, as well as establishing those parameters for decision making regarding not only the exams as a whole, but how we look at individual items, how we process revisions, and any adjustments that need to be made. So policies for administering, analyzing, and reviewing exams are important for both faculty and for students. Now, this next slide is important because we need to think about where do we start? You know, many times, no matter what we're doing, we can start with this excellent advice from Stephen Covey, which is begin with the end in mind. In education, we often refer to this as backwards design. But what we want to do is, why are we doing this? What do we need to know? And how does this testing policy impact our program? Well, we have to consider the entire curriculum, starting with not only our mission and philosophy, but also that of our institution. Our policies need to be congruent with those of our institution. So we start with that big picture, our desired outcomes, our mission, our philosophy, and that includes understanding who we are and who we serve, right? We have to think about who are our students, how do they come to us, how prepared are they, how does that impact our admission policies and any testing associated to that, including every step all the way through our program to the point where they graduate. So what we're looking for is to be, congruent, consistent, fair, and ethical. So we create a master plan that helps us to develop these policies and guidelines so that we can determine how our test banks, our process of analyzing those exams, revisions that we make and the impact of those revisions on grades or outcomes, how all of that will be managed. And it helps us to identify the leadership and the resources that we have in our program and perhaps even in our institution to make this process as fair and as equitable as possible and to increase the quality and the reliability of our exams. And finally, a master plan also includes ways that we support faculty development and can really encourage continuous improvement. So we want to use exam data to assess the achievement of our program outcomes. I mean, that is our bottom line, because as we assess achievement, we are then going to be able to support success. And when we're supporting success, we're doing that through remediation, through retention, through clarity, and through providing testing that is truly the best quality we can provide. So to start that, it's important that we have a testing committee. And a testing committee, depending on the size of your organization, it might be a standalone committee. This is their only focus. It might be a component of your evaluation committee. We think it's best if it's not part of the curriculum committee because these are two groups that should actually be feeding information to each other. But we develop a testing committee to sort of guide this process, right? They're going to help us identify the measurable achievements of our program outcomes to make sure that those are mapped and assessed across our curriculum. Now, the testing committee can take the feedback from our exams, both teacher-made as well as our standardized or those summative exams that we give, and combine that with information we get, for instance, from the National Council State Board of Licensing Examiners results or from the results of our graduate students on their certification exams. We can take that information and then use that to find and correct any gaps in our curriculum, any gaps in student achievement of components of our curriculum that perhaps it requires some retooling of lesson plans or of delivery. A testing committee can also identify those resources and processes and the supporting documentation for helping students who are academically at risk. How do we identify them? How do we do early intervention? How do we use this assessment process to support programmatic success for students as well as the program itself? Testing committees can help create this policy that will guide faculty decision-making so that we are all operating from the same set of guidelines, if you will. And then they provide that legal and ethical necessity. A testing committee's job is to assure that we are using assessment in a way that is fair, that is consistent, that is communicated to stakeholders and consistently followed. So what we want to do is avoid that too little, too late response. So thinking about those at-risk students or students who simply are not demonstrating that competency at the rate that we would be expecting, right? So how do we make sure that we are supporting their success long-term? We want to identify those concerns. So we use recommended scoring benchmarks, and then we complete that evaluation loop. Just collecting data is not sufficient. That's true in any kind of assessment. When we collect that data, we need to do something with it. So our testing policy helps us to support that process. How are we going to use this information to support student success? And so that involves bringing in course coordinators as a part of that process. Who coaches our students? Who works with our students? This might include even developing some collegial relationships with a success center in our university or with a teaching and learning success area where they help us to make sure our policy is logical and defensible and talk to us about ways to help students understand the data and remediate. So all of this leads to our ability to establish plans for remediation. And to formulate tools that will help us to document this and to put this into a written plan that everybody can follow and understand. So all of this is extremely important to the success of our program, which means also then to the success of our students. Now, one of the things we start with once we realize that we need this testing committee, that we want to have a comprehensive testing policy, is as we're putting this together, we're going to be thinking about the master plan for our program. So I'm going to be talking a lot now going forward about how we can lay out that plan for testing within our program, the courses, and the curriculum. But I'd like to mention first that in your resources list, and also in the appendix that I provided for this particular session in this series on test taking, you will find references to testing policies. There's an advisory that is published by the Arizona Board of Nursing, and there's a link to that website. And there's also a sample testing policy at that site. And these are great resources for you, in addition to the articles that we provided that really will provide some additional information to support this entire series. So I highly recommend that you download those handouts and use those to move forward in assessing where you are now or where you want to go. But let's talk a bit about those course plans. There needs to be a conversation about general policies for exams in your courses, in your curriculum. How many exam items do we put in a unit test, in a comprehensive final? How many exams do we have in a course? What length of time do we give for our exams? What length of time do we give for each question? So we have this sort of a master plan, if you will, of exams across our curriculum. Some programs also include in that how many questions in addition will be used for quizzing activities and class activities to, again, use some of that formative assessment and build it into. And that's something you can talk about, and maybe a second step once you've established sort of those baselines in that overall policy. But these are things that we decide as a committee. We get support and consensus with our faculty groups. And then we all have to be held accountable to following these guidelines. And this is important not only to protect our program and ourselves, to be defensible against any accusations of unfairness or those kinds of grievances that students might file, but also this provides a sense of security to our students. So we are helping our faculty and our students by having these policies and this master plan going forward. Well, here's just one example of how you might think about your course policies, your course master plans for exams. First, you have to address this question. Do we give a comprehensive final or do we not? Secondly, do we put a final exam at the end of the course close to that last unit exam? That's always kind of a conundrum. How many exams do we want in a particular week? And how do we address this? So here are two options that might be looked at. In this one course, we have 4 units. So one option is that each unit has a unit exam. Each of those exams have 50 questions. And then we're going to do a final exam at the end of the course, where each unit has 25 questions on that final exam, and it's worth a total of 100 points. So we're giving 300 questions that apply towards the grading aspect of this course, whether this course is 100% based on testing or 80% based on testing. Those are all decisions you make as a faculty, but they should be consistent within your program. Now, another way that this might be handled is that if we don't want to have 2 tests very close together, we're going to roll that last unit exam into the final exam. In this case, we had 50 items for each of the first 3 units. We have 50 items for the 4th unit, but they're going to be incorporated into the comprehensive final. So now we're going to add questions from units 1, 2, and 3 to bring forward that information, test for retention across the semester, and we're going to have a total of 250 items. Now there's a difference here, 300 in the earlier version, 250 here, because we have combined those in that last one. So that's the kind of decision making you want to engage in as faculty as you start the process. Or if you're not consistent now, I recommend that you have these discussions about how are we approaching this, how is it working, what's working best for us, and how can we do this. Now, it's important that we develop blueprints for testing success. Blueprints lay out our plan and give us the opportunity to make sure that we are following our objectives, our goals of being consistent, of doing an effective job of assessing student learning and having opportunities to make adjustments and corrections. So here's our second polling question. I'd like to know, do you currently use a blueprint for your exams? So this will simply be a yes, no, sometimes. And maybe there's a few of you who are saying, well, I'm not exactly sure. Tell me what you mean by blueprint. And so we will actually be looking at that. But we're curious to see what your responses are. And once again, if you're live, we'll give you a moment here to get that entered. If you're in the archive, you can pause this and discuss it with your colleagues if you wish, or in just a moment, we will share those results. So Sharon, I think we can go ahead and take a look at the results here. And it looks like the majority of people are using a blueprint. That's excellent. Well, not quite majority, almost though. Almost half of you say yes. And then by far the majority of you are saying yes or sometimes. Now, about a quarter of you are not using a blueprint at this point, and there's just a few that are not sure what that means, and that's okay. So let's go ahead and close this, and let's move on to talking a little bit more about what blueprints do for us. We want a blueprint because it will help to establish content validity, okay? Content validity, Karen's going to talk about in more detail a little bit later today when you look at the item analysis webinar. But in a nutshell, it means, are we testing what we say we're testing? It will demonstrate that I have a test that reflects the content I'm testing on. So that's important because it also then validates some fairness and some consistency in the exam. A blueprint will also make sure that we are following our test specifications. So it's the evidence that we are following a plan or a blueprint and being consistent with our test plan. A blueprint should also help us to demonstrate that we are representing the domains that are inclusive in our curriculum design. So your domains would include, are you mapping your curriculum, for instance, to the AACN Essentials? Are you mapping your curriculum to CUSIN or to the NLN Nurse Graduate Competencies? Are you using the National Council of State Boards of Licensing test plan? So these domains and our framework need to be represented equitably in our exam. A blueprint helps to demonstrate that, but it also helps us to make sure when we're putting it together that that's exactly what we're doing. A blueprint, because it means we've created an intentional dispersion, right? An intentional mapping of the exam to the content we're testing will imply some reliability. So whether I'm giving 10 items or 100 items or 50, that there should be consistency in any of those versions with how students perform because I'm using the same map. Now, we do know technically that the more questions we have, the greater the reliability over time. But that principle of reliability is so important. It also addresses what's being measured. What are we testing? And once we've created the blueprint, then it really helps to expedite the item development because we know exactly what we're looking for. We plug our questions into those boxes, if you will, to create our test. Let's talk for a moment about content validity. Content validity is does the test measure what it claims to measure? And again, Karen will expand on this a little bit more later today, but I did want to bring up the fact that our test blueprinting is one of the processes we use for validity because we develop those parameters for the exam and then we have identified on our planning sheet, on our blueprint sheet, the concepts or the competencies, your unit outcomes, whatever outline criteria you're using to teach that unit of study, we're using that then to plan the exam. So it's being linked to those outcomes and objectives. We also then can demonstrate how we are building our questions according to Bloom's taxonomy in order to that level of difficulty, which again is going to be so important as we move forward and can graduate students who are prepared to test at that application and analysis level, and even higher when we look at clinical judgment and the next gen exam. So we're going to also want to make sure that we have dispersed our questions equitably across the nursing process, which will then be inclusive of the clinical judgment measurement model, as well as those concepts that are, if you will, threaded or dispersed throughout the curriculum, things like teaching and learning principles, caring practices, cultural awareness, and so forth. And then this can link us also to the NCLEX test plan, to competency exams, to the BSN Essentials, et cetera. So this blueprint is a critical document in terms of really validating the process for fairness in testing. So the recipe for a test blueprint, well, we need to, again, go back to our master plan. How many items do we anticipate for each focus area, whether that's a concept, a topic, the number of hours we have, however you define that. And we fill this table in. Now, as I mentioned in that appendix, I have a kind of quick and easy example of a test blueprint. There's no required format or one way to do it. I would advise, if you're just getting started on this, that you look at a variety of options. Maybe talk to colleagues in other programs, ask them what they use and how it works for them, and if there are any areas that they're less happy with. And look at your options and create something that works well with your curriculum in your program. Then you want to decide, how many of these items are going to be at a lower level and at a higher level of difficulty. And as well as, do we have some alternate format questions in this? How many? What's the right number? So we use these parameters that will outline our exam, and we map those, and it becomes essentially a grid that we fill in. And then how many items in each of the domains of nursing practice from that test plan, so that, again, we can make sure that we are covering the expected competencies for our graduates as we map this across a single exam as well as across our program. So we select existing exams that match our blueprint, and if there are gaps, we have to create some new items for this exam. So this drives a point that exams should be planned and developed well before you need to administer them. Because if you need to create some questions, you want to do that earlier than later. You want an opportunity to have colleagues review those questions, maybe even test them with another group of students to make sure that it's going to be a good question that you put in. So I recommend blueprinting and putting together exams as part of class prep. I have my exams done before I ever have that first day of class. Now, if I need to make a couple of adjustments, that's fine. But I have the bulk of the work done, and then I can review it and make any adjustments based on instances that came up during that particular class or with that group as I near the exam administration time. So matching the content with the exam proportions. In other words, I want to make sure I'm giving a balanced exam. So there are some ways that we can do this. One is that we can look at how many hours of lecture or contact time in the class and lab were devoted to that particular content. So in this case, we're looking at essentially a systems-based curriculum design. So our content is around neurosensory, renal, immune, immunity, burns, and GI. How many lecture hours were allotted to that particular topic? And then I divide my exam appropriately across those topics. So you see that in exam one, it was equally split. So each area of education got 25 questions in the exam. Before our second exam, we had 3 topics, and they were not equally dispersed across that unit. The GI content was heavier, and we had only 2 hours in the burns unit. So as a result, those areas had a proportionately appropriate number of items, but not the same number. But bottom line, each exam consisted of 50 test questions. So again, we do this simply to make sure that we are being consistent and fair in how we approach our exams and because we want to get important data. We want to know how the students perform on this, and we want it to give us feedback. So it's important that we follow these guidelines. Here's an example of a test plan that's based on concepts or nursing process. So we have a 5-step version of the nursing process across our top axis. And then we have the concepts that we've included in this particular unit running down the left side. And so then we plan our questions within that. So it literally is a matrix that we fill in as we get started. I think I might have gone one more here. Okay, now this is a different example using course objectives. Now, ideally, we're actually going to merge several of these into one document, which is exactly what you will see if you look at that appendix example. But here we have our topics and then the course objectives so that we can make sure, again, we have that good distribution. And finally, showing the NCLEX blueprint across the 4 areas that we are addressing: teaching, assessment, intervention, and culture. So these are ways that we can make sure that we have a balanced approach to testing for our students. Now, we are seeing an increased emphasis on competencies, and you will be identifying competencies in your program regardless of who you're accredited through or which standards and taxonomies you use in your program, because competencies are in the language of CUSIN, competencies are in the language of the ANA Standards of Nursing Practice, competencies are the language of the accrediting bodies, competencies are the language of the National Council and the Clinical Judgment Measurement Model. So think about how you are assessing your students on those competencies and then map those in addition. Now here's an example of a map to the NCLEX content as well as some other selected taxonomies. So you can see how this starts to grow. We have the topics or the concepts going down the lateral axis, and then we have the National Council areas of care across the top. We've identified now, are these knowledge and comprehension questions or application and analysis questions? So we're starting to build a more complex map in this example. So you see how this starts to come together. So keep in mind that the NCLEX test blueprint is an important key to our distribution of questions as well as content in our curriculum. That blueprint is also evidence-based. The blueprint was driven by the practice analysis, which is that research is repeated every 3 years, and then the new results become the new evidence to make adjustments in the exam blueprint. So that is an excellent source for our content validity for our curriculum, and then it becomes content validity for our test blueprints because this is all trickling down from the same master plan. So these documents interface with each other, and that's an important part. And it's one of our keys to curricular success. When we developed a program, a curriculum that matches what our students need to be successful, we base our assessments on meeting those objectives and those competencies and outcomes. And we've got everything mapped out so we know exactly what happens, when, and where we need to make improvements. So this is can be done with your other competency exams in the same way. Those evidence-based resources out there are an important part and resource for our program. When you look at the cognitive levels for your blueprint for your exams, keep in mind your Bloom's taxonomy, and that will be a theme again throughout the day as we talk about testing and assessment practices in nursing education. And as you are well aware, we're trying to move quickly up from that remember and understand to helping students apply and analyze and eventually evaluate their nursing practice. And that create part is a way that we bring it all together. So keep in mind that the NCLEX is based on the practice analysis of recent graduates. So its testing should not be asking what the student knows, but rather assessing how the student thinks, how they're going to perform as a nurse by applying their clinical judgment. So when you're coding your questions, choose the taxonomies or criteria that work for your curriculum, that your curriculum was built on. That's your choice, which ones you use. And there are a variety of options out there. And then make sure that you're creating testing policies and mapping your exams to reflect that design that you chose. And these are all examples of options available to you. So I want to do just a quick little pause and consider, and then something that you can do as you move forward. Think about what taxonomies are most appropriate for your program, or even just for a course that you teach in that program. So if you were creating a blueprint right now for your next exam, what would be the 3 taxonomies or the criteria that you would choose to assure validity and balance in your exam? So if you're in the archive audience, I encourage you to go ahead and just pause for a moment and consider that. And if you're in the live audience and you do have a copy, or at least have access to a copy of these slides, why don't you put this on your list of something to think about and maybe even discuss with some colleagues as you continue forward. So here's another sample of a blueprint that's including that Bloom's taxonomy. So we have our content, we have the level of difficulty for our questions, the lower level versus higher level. We have nursing process, and then you can add at the end the competency or the categories that are important for your program, for your exam. But notice that when we look at the yellow boxes down there at the taxonomy, that we are definitely moving to more of the questions being at that application and analysis level. And we have our totals are going to be the same down below. So this starts then to build to be a more robust map for creating your fair and effective examination or testing for your students. Now, the next thing that I like to do once I've created that blueprint is then to give some intentional thought to the questions that I have available that I'm going to use in that particular unit of study. So let's say one of our units was pain. So what are some of the key concepts or aspects of pain that I want to include in this exam for my students? So then I can choose questions that fit the blueprint, but also make sure they cover these areas of study that were important. So I'm going to find questions that address each of these and disperse well on that blueprint. So yes, this is a lot of work. Creating a really good, fair, helpful, informative exam is work for faculty. But the most work is the first time you do it, because then we're in a process of continually revising and improving. So you take what you had, and then what did you learn from that, and make adjustments, and you've got a head start the next time that you give that exam. So how do we get started? Well, identify several short lists of ways to organize. Think about nursing process, but also think about how you're going to incorporate the National Council's Next Gen process, that clinical judgment, which they've given to us in the form of a clinical judgment measurement model. Think about that NCLEX test plan. How familiar are you with it? Do your faculty get together when a new plan is released and look at it in depth? Talk about any changes, talk about how that might impact your curriculum. If you're educating pre-licensure students, it is absolutely important that you are very familiar with the National Council's test plan. And remember, that is renewed every 3 years. What are the core concepts that are integral to your curriculum? And then how do these lead to and become your course objectives or your unit objectives? And then finally, propose 2 or 3 that make the most sense for your program. Stick to that plan. And of course, this whole process needs to be evaluated on a regular basis. We debrief our exams after each exam. We think after each semester, after we've delivered a course, what went well, what can we improve, What do we need to put on our to-do list? And then we do that big picture look at our program at least annually. So the testing committee feeds into the evaluation committee, which collaborates with the curriculum committee to make these continuous improvements in our program. So when it comes to testing policies, start by going back to your colleagues or with your colleagues, say, where are we now? What is our situation right now? What do we have? What are we missing? What do we still need? And then create that plan. Start with the basics. Start with what's most important for you now, and then build on this. Testing policies, exam banks, the exams themselves are always something that we can improve. We're in a continuous improvement process. Sometimes because extraneous or outside forces create changes that we need to respond to, such as changes in the test plan. So these are all components to keep in mind, and that's why it is a process, not something that we should consider an individual work for us. And then here's another important piece, blueprint transparency. A blueprint is not a detailed study guide. As you saw in those examples that I showed you earlier, they're simply placeholders where we're going to put questions. So these should be shared with students. Look, students, you're going to have 50 questions in this exam. This is how they will be dispersed across the content. And notice that I'm going to pay attention to these pieces. And that way students know that the exam's going to be fair. It's going to cover the entire unit of study or not. If there are areas that are not going to be in this exam that are being assessed, for instance, in the lab through a simulation, they know that also. So share it with students, share it with other courses. Let your plans build to a master plan for your program. The curriculum committee should have access to and be able to give feedback on these plans. So remember, this is your evidence of validity. It demonstrates your fairness and your effort to provide balance in your testing. So selecting and building test items, I'm just going to give a couple of words here as kind of a preview to some of the giving attractions or future attractions. Test banks in nursing. We're going to be talking more about how to write test items or edit and revise items in the next hour of this series on testing. And so just a reminder that test banks that you can get from a publisher or that have been around for a while in file cabinets or online courses, et cetera, that they're a great place to get some ideas and maybe once in a while a question that you can just modify a little bit or alter to fit your class, but they are not a place to get questions that you just move wholeheartedly into an exam. You can count on every exam or every question that's in an established test bank to have been shared somewhere out on the web or on your campus or through a resource for students. Just count on it. So your questions need to be highly secured and they need to be rotating through your exams to provide as much security as possible. And that security aspect is also part of your testing policies. So don't rely on test banks. Stay with us for this series so that you can see other ways that you manage your test bank and you can create and modify questions as you go through it. And you always then have a way to collaborate with colleagues and get feedback for continuous improvement. So as we're wrapping this up, I'd like you to really consider how are you going to use this information to improve your testing practices? And to get started, just think of one thing, one action that you will take as an individual. That might be pulling an article from that reference list and reading it and talking with a colleague. It might be learning more about testing policies at your university and how those can inform the nursing programs policy. It might be simply having a conversation with somebody who, in your program. If you're a leader, with somebody who might be a representative of a committee. If you're new to your program, with somebody who has more experience there. What's an action you're going to bring to your team or colleagues for feedback or consideration? What's something that you picked up that you would like to have a conversation about? So please take a moment to jot those down so that you actually implement something new or learn something new or have a robust discussion following this presentation. Now, we want to remind you that if you need some additional help, consider looking at the other webinars in this series. We're going to talk about test item writing, about item analysis, and how to incorporate next-gen cases. So with that, I think we are ready to move to questions and answers. So I'm going to open the question and answer pod here. And so I see a question: is there any evidence-based practice describing the optimal length or number of questions for a unit exam? You know, that's a great question. And I know my colleague Karen is on board here too. And Karen did a lot of work with that advisory from the Arizona Board of Nursing. So Karen, feel free to join in and dialogue with me on this question. But bottom line is, to my knowledge, there's not an optimal length per unit exam. I think what you need to ask yourself is, do we have enough questions in this exam to get a fair and accurate snapshot of students' performance, of students, of how well they learn the content? Do we have enough questions that we can adequately map it across those competencies, across the standards that we're using? So when you create your map, do you run out of questions before you filled in the gap? Also, remember that going back to that reliability, the number of questions is less important, I think, than the quality of the questions. So that might be another piece. So if others have questions, please feel free to type those questions into the Q&A box. And you also have the opportunity of adding on to somebody else's question or responding to them if you have something to share. So we will see if there are some other questions. As we're waiting, you know, I never know if no questions means, wow, that made a lot of sense to everybody, or I'm really confused. But what I would recommend is take advantage of those resources that we gave you. And I see now that I have a question about, we mentioned trying the questions out with another group of students before putting in the test. How can that be done safely? That's a great one. So one thing is that you may actually use a new question as a pilot question in class and have two versions of it that are very, very similar, but ask the question and see how students work through it. And that will give you some insight in how they were thinking about that. And then you use a version of that question or a slightly different version in the exam. I sometimes will, in fact, one of my habits in teaching is to include some questions sporadically throughout my class session. I'll open with a few questions. I might put several occasionally throughout and then end with a few questions. And I always tell students some of these questions might show up on the unit exam because I want them to be engaged in understanding the question and having a dialogue about the rationale. So that's one way that you might do it. Or if you've got first-year students and you have a group of second-year students, you might just have them work through some of those questions with you without sharing to them that you're going to use those in an exam. And bottom line, students rarely remember details about a question after they leave the situation. We also have about any experience with the Kaplan test prep and exam soft regarding blueprints and item analysis. I am more familiar with the ExamSoft product, and I know that they fit with blueprinting, and they also provide some excellent feedback at the end of exams to the students in terms of strengths and weaknesses, which again is one of the purposes of exams. Most of your major test software programs, your proprietary ones, are going to provide more robust interface with blueprinting and with item analysis and scoring and feedback than will your learning management systems. By that I mean, if you're using a learning management system to deliver the course, many times the testing programs in those learning management systems are going to be more limited. So you're going to have to do more work outside of the learning management system, perhaps in other software that you have available in your program. When we talk about the hours of lecture, do you consider the time that information is being presented, or do you include a day that they may work on a case study or other activity? For example, 4 hours present the content and then 4 hours actively working on a case study. That's interesting. Liz, first of all, I think it's awesome that they might be spending as much time working on case studies as they are interacting with the faculty in a more structured delivery. So what I would say is it depends a little bit on how you've laid that out. Think about your credits. Are those hours that they're working on activities considered a lab component to the course, or are they considered contact hours? In other words, if a 3-credit course has 45 hours, would that be 8 of the 45 hours, or is that 4 of the 45 hours? And I think that's partly what drives your decision. And make sure that you're doing it in an equitable way across the course. So I would say that's kind of up to you, depending on how many hours you're looking at total, how many exams you have, but then it needs to be consistent, right? I mean, so it's a great question to bring to your policy committee. And then you mentioned 3 or 2 to 3 taxonomies for the nursing program. I need to scroll this down a little bit to read that completely. For the blueprint, as I meet resistance to all the extra work for creating, maintaining test blueprints, I'm looking for the best practice. Do I think a certain number is better? I think fewer is better than more. Okay, I will say that, because yes, it is a lot of work. So I would say that we need at least 2, because I do think that if we are a pre-licensure program, that it's very important that we are mapping to the National Council's test plan. And then depending on who we're accredited with or what level our program is, at associate, baccalaureate, there may be another key one that's important. But for instance, if we're already mapping effectively to one of those standards and it covers everything, then I would say we can kind of limit that. So again, but don't let your faculty resist having a blueprint or having test policies because of the extra work. It's not extra work. It is actually an investment in more efficiency and more quality to your program, and helping students reframe that. No, this means you're doing a different kind of work out front. But once that's done, it saves time going forward with future exams, and it helps to assure that our program is higher quality, more effective, and will have better outcomes. So it's an investment. It's not add-on. Amber says, as we move into using more next-gen questions, are there any changes to the blueprinting format or tips that you have for blueprinting these questions? That's a great question. And Karen will probably address that a little bit later today. But what I would say is that what I did is I actually merged the clinical judgment measurement model from the next gen with the nursing process. And if you go out to their website and look at the model, they show us how they run parallel. So I've merged those so that I can still make sure I have a distribution across. Now, I also want to make sure that I am thinking about that in terms of my taxonomy of the difficulty of questions, because my next gen are going to be typically a little more difficult question. So it's going to be evident there too. And then building off that question, what about NGN cases in blueprinting? As we go forward and as we develop and have greater access to software and resources for including next-gen questions in our exams, then yes, we want to include that as a part of our blueprinting process. Well, remember, with those next-gen style, you have a couple of standalone and you have the 6-question case studies, and those are going to cover multiple components. So you will need to get a little bit creative on how we include those. And actually, it's a great question to bring to the group of how we map ours. And so we will look at providing a resource later today that might help you with blueprinting those next-gen items. Looks like we've done pretty good at getting through those questions. So I think I'm going to turn this back to Sharon, who will share with you the link for the evaluation of this first session in our testing series. I invite you to attend the others, either live or in the archive as those get posted. I thank you so much for joining us here for this webinar.
Thank you so much, Ginny. Yes, we welcome everybody to join us for the next 3 webinars in this series. And in the meantime, we also would like you to fill out an evaluation for your Nursing Continuing Professional Development Contact Hour. And we welcome your feedback and questions on that evaluation as well. For our live viewers, a new screen is going to appear in just one moment. Please click the Continue button to proceed to the short survey evaluation that will produce your certificate. And for our archive viewers, please click that evaluation link on the right side of your screen. Thank you to everyone for joining us today. Bye for now.